My name is Laura Dixon, and I'm your presenter for today. And I do want to thank you for attending. We're here today so that if you ever have a survey by CMS, which of course every facility has them at some point in time, you don't receive one of these. One of them, of course, is a statement of deficiencies, and then the penultimate would be a termination, involuntary termination from CMS because of a failure to follow up with any deficiencies. Right now, CMS is not performing any surveys unless it's for immediate jeopardy or based upon complaints. But nonetheless, they have pretty well stopped. They will resume once the pandemic is deemed to be over. We're talking today on the conditions of participation. I want to start out with a broad view of the conditions. That is literally the manual that CMS works off for all of the facilities and entities over which they have survey and which they have control of. They started back in 1986. Each section has a particular number called a tag number, and that is how the surveyors review and identify areas for which there may or may not be a citation. That has been updated very frequently since they were instituted back in '86. Right now, the medical records section is from 431 to 469. I think that's not very much, but that encompasses multiple pages. The regulations all start out in the Federal Register that is determined by Congress. So those are the actual regulation. Then CMS, Centers for Medicare and Medicaid Services, come along, look at that regulation, and they put in their interpretive guidelines. Interpretive guidelines help us understand what is CMS looking for. It's their explanation, it's their interpretation. They may have survey procedures, and the survey procedures are just that. When a surveyor comes out, that's what they're going to be doing. Some have them, some do not. Now that doesn't mean CMS doesn't have some document that they can actually work off. For example, there are 3-week worksheets that are available to the public, and those are infection control, discharge planning, and QAPI. Nice thing, they've made these available to us so that we can download them, pull them off, and see the actual questions that CMS will be asking of us. To stay abreast of what's going on with any of the conditions of participation and CMS in general, you can sign up to get the Federal Register. They will send you emails with updates once you sign up. You can also check the survey memos, and that's exactly what it is. It's a survey memo. These are the policy and procedure website. I include the websites when I can. This is how you would get to that certification website. These are what the surveyors get when something has changed. To get to the most current one, you triple-click the column that says posting date. They start fairly recent, then go way back to 2007, and on the third click, you will get to your most recent one. You can see from here, they have a lot to do with COVID. The manual itself, it's a playbook for a CMS. That's what they operate off. That's where they tell you where everything is going to be. They also have split them out according to facilities. That's your appendix. Hospitals are Appendix A. These are your acute hospitals, those large ones, those medium-sized ones, and they even wove in psychiatric hospitals back in 2020 to the hospital manual. They felt there was so much overlap, why have a different manual? Critical access hospitals, yours is Appendix W. If you're under EMTALA, that happens to be Appendix V. And then even emergency preparedness. They separated out all of the emergency preparedness requirements that are contained within each manual, but they put it into its own special index. And this is what you will find once you open up the index. Let's say it's for a hospital here. That's the table of contents that you would work off. And that is the one for critical access hospitals. Some of these, if you put your cursor over a particular item, you'll see the hand come up and it will click you right to that. That's not applicable for all of them, but for the majority of them. As far as deficiencies, what are the deficiencies that CMS is coming up with? Right now, you can access that complaint data. In other words, the data that the surveyors, bring back and identify according to any deficiencies. Includes all hospitals, acute and critical access. They list it by tag numbers. They also include the name and address of the actual facility. They may include some information in there, just a very brief description of what they found. And the other thing it does not include is the plan of correction. You can get that. These are updated quarterly. Over the past couple months, of course, since they have not been doing some of the surveys, a majority of them, we're going to see some numbers go down, but this is how you access it. I showed you the website link, and it's below on this particular slide, on slide 14. Go to where it says Full Text Statement Deficiencies Hospitals. That's where you will get it. It's an Excel format, and it will give you, like I said, all of the information for the past several years that they have done surveys. Now, the nice thing is you can cut and paste and copy whatever you want. You can tag it. You can identify it according to certain things to find what you particularly want. So what I did is I took the medical record chapter deficiencies, as I said, the tag starting at 431, and I can isolate those, and I can count up how many deficiencies there are. And as of last month, these alone are the number of deficiencies. On this particular section, form and retention of record had the most deficiencies. That had to be, they maybe didn't have a policy and procedure that addressed it. On here, you will see the services, the date and time. Those were some of the hot areas that CMS was targeting on when they were doing their surveys. And then here, of course, the notes, the orders, and reports for a total of roughly over 1,700 deficiencies. These are cumulative deficiencies. So it's been going on since the time that they registered. Now, there have been some changes with that. Some of the old material may drop off, and it's gone. So from the beginning of time when they started doing this, we won't have all of that information, but this will give you an idea, number one, of what they're finding and where they're focusing, and then how much it is. If looking at an Excel spreadsheet isn't your cup of tea, there's also a paragraph form that you can find the information on hospital inspections. And that is where you would find it at the hospitalinspections.org. Takes a little bit more time, but again, if Excels aren't your thing, then that's paragraph form. I'm going to talk briefly about mandatory compliance and also with Joint Commission, because some of the people on the phone or on listening to this recording may be Joint Commission certified and deemed status. As far as mandatory, if you participate in Medicare or Medicaid, in other words, you're on the beneficiary to receive payments for their taking care of their patients, you have to meet all of the conditions of participation. And that is for all patients in any of your facilities that are so certified. This includes hospitals that have deemed status according to the other accrediting bodies or accrediting organizations, such as Joint Commission. If you are so deemed status, you don't have to go through a state agency survey. CMS recognizes that these deemed statuses, these accrediting organizations, have requirements that are the same, if not stricter, than what they have in their conditions of participation. For example, let's just take emergency preparedness. Like I said, CMS has a whole index on emergency preparedness. They talk about internal and external disasters. They don't pin it down to certain things such as active shooter. Now Joint Commission does do that. They have guidelines and information on how a hospital can prepare for such thing as an active shooter. So again, some of these accrediting organizations have a little bit tougher and stiffer standards than what CMS does. You can also get a complaint validation survey, even though you might have an accredited organization deemed status. That doesn't mean CMS still won't come out. They would provide oversight for that deemed status. And if it is bad enough, let's say it's immediate jeopardy situation, CMS may still come out and do a review. Joint Commission did revise their requirements for medical records in particular. They have two chapters, and one is called Record of Care, and the other is Information Management. There have been multiple changes over the past 2 years in respect to those two chapters in particular. And what they wanted to do was bring their standards more in alignment with what CMS was saying. And so over the past couple of years, they've done a very good job at doing this. Record of Care has 9 particular sections on it, and it talks anything from authentication to discharge information. Under each of those, you'll have what's called elements of performance, and that's like the interpretive guidelines that you would see in the CMS standards conditions of participation. As far as information management, there are 7 standards particular for medical records. It talks about privacy and security, how you collect and transmit information, and then knowledge-based resources. If you're a member of Joint Commission, this is a very good resource for you also. So what about standards of care and practice? As far as medical records, CMS does incorporate standard of care and practices into their regulations. They won't tell you what the standard of care is. They will just say such thing as referred to, say, a HEMA. That is the American Health Information Management Association. Or they may say refer to CDC, refer to American College of Surgeons. That's how they incorporate those standards of care and practice into their regulations. By the way, AHIMA is a very good resource. It includes tools, and it has some standards spelled right out in them. There are briefs on privacy and even electronic signature. And that is how you would access those from AHIMA.